Hey everybody, welcome to my third video about being a new nurse, where I'm going to talk about the pros and cons of working in an ICU, as well as the pros and cons of working night shift, because that's what I do. And I originally recorded this video along with those other two, part 1 and part 2, but I realized I left a bunch of stuff out, so I re-recorded it. And this is that video. I also realized that this camera can record in HD, so it's going to look better than the other two videos, as long as you record in QuickTime, which is what I'm doing. And yes, so this is video number 3 about being a new nurse, pros and cons of night shift and ICU. So starting with night shift, I've been working night shift since I've become a new nurse. I'm into my 9th month now, and I'm going to start with pros. Probably the biggest pro of working night shift is the money. You get paid more working night shift. If it's also the weekend, you get paid even more. If it's night shift a weekend and it's a holiday, you get paid a lot. So that is an awesome benefit of working night shift, the money. All right, so compared to day shift, night shift is also, for the most part, less busy. It's not to say that shit doesn't hit the fan at nighttime, because it does, but overall, night shift is a little more calm if you compare it to day shift in the ICU, at least the one that I am. Night shift's definitely not as busy. So the things that make night shift not as busy, your patients, if they are on a normal internal clock, they might actually sleep, which is nice. And it's good for the patient. They need to sleep. You don't see as many doctors rounding on the patients at nighttime. Unless you get a new admission, you might see some doctors coming around, but typically you don't have teams of doctors coming around giving new orders at nighttime. You don't have to serve any meals at nighttime. Those are all served during the daytime. Not that it could be super hard, but it does take time, and if you have patients like in the ICU that need help eating, it's just one more thing to do. So breakfast, lunch, and dinner are all served before the 7 p.m. shift starts, at least at my hospital, and I think that's a pro of working night shift. It's just one less thing to do that's already completed during the day shift. Also, you have less visitors that come around at nighttime in the ICU, most likely because you're not allowed to have a lot of visitors coming into the ICU at nighttime. We actually want our patients to rest. And it's not that visitors are bad, it's just that sometimes they're a distraction to you getting your work done. And I mean, it's good if there are visitors. You need to interact with them. They're worried about their loved one, and you gotta, show sympathy and all that stuff. But it's just sometimes you have family members or friends or church members or long lost relatives that are showing up. That's usually during the daytime, and it just takes up more of your time to get your work done. So that's a pro of working night shift. My nose is itchy. Sorry. If I was gonna talk about cons of night shift, the biggest and maybe the only con of working night shift is your body might hate you for a while. Your internal clock gets all screwed up. You have to get used to working and staying awake all night and then sleeping during the daytime. So at first that was really hard for me. My body did not like to stay up all night and then try to sleep during the daytime, but at this point I'm very used to it. I'd say it's a con that, say you worked all night, your next day, if it's a day off, you're gonna either have to sleep some or sleep all day and then be awake the next night, or you can try to just sleep a little and then wake up and enjoy the day and then go back to sleep at nighttime. So trying to switch your internal clock back and forth from your work nights to your days off, that can be difficult. I've kind of come to the point where I'm nocturnal, and on my days off, I'm basically up all night. Or I wake up really late and then I go to bed really late. Usually go to bed around 4 a.m. or something on a day off. But that's just what I do. So that is the biggest con of working night shift. I mean, some people might say at nighttime you don't have the doctors right there on the unit walking around as much, where you can quickly grab them and, you know, ask them a question or get a new order. But I mean, at night shift we can always just call or page a doctor, so that's not too bad. You might have to page a doctor that wakes up, you know, in the middle of sleeping, and they might be cranky, but I don't know. I'm not bothered by that. I'm going to wake you up if my patient needs you. So yeah, those are pros and cons of working night shift. So now I'm going to talk about pros and cons of working in an ICU, because I've only worked in an ICU since I've been a new nurse. Starting with the pros, you have, in my unit, a max of 2 patients, unless we're really understaffed. Some of the more veteran nurses might get 3 patients. And it gives you the opportunity to focus on just those 2 patients. You don't have, 6 or 5 that you happen to run around to. Now you might only have 2 patients, but they are going to be very critical patients, so your nursing skills are going to stay on point, which is pretty cool. You're going to see all sorts of stuff. You're going to do all sorts of interventions. So if you want to do a little bit of everything and become, top of your game, then that is a pro of working in ICU. You get to do all of that. And it's kind of cool. You're learning to take care of the patient in their worst state. So basically you learn how to take care of someone when they're on the verge of dying. And I think that's really cool to be able to know how to do that. When you do have patients that are in such a state, you are going to have some code responses. I work in a cardiac ICU, so we see the most amount of codes that happen in the hospital. So if you like experiencing that ACLS stuff, where you get to do CPR and defibrillate patients and push meds and try to get their heart working again, then you're going to see that more in ICUs than on the floors. It gets your adrenaline going, and I think it's kind of exciting to be able to take part in that. Not that I want it to happen, but it's going to happen at times, and it's most likely going to happen in ICUs. And then lastly, I'd say that it's nice in an ICU that your patient is on continuous monitoring right at the bedside, so you can walk in the room and immediately see their heart rate, their rhythm, their blood pressure, oxygenation status, all that stuff right there on the monitor. So the cons of working in an ICU: you could very well, even though you have 2 patients, you might have 2 train wreck patients who, and I don't mean literally they were in a train wreck, just patients that have a lot going on that could be a hot mess, or could be starting to crash and burn, or they could literally be from a train wreck. You have a lot to deal with. You might have vents, tubes, drips, drains, all sorts of stuff going into and out of your patient, which can be a lot to handle. So that could be considered a con of working in ICU. Eventually I got comfortable with that, so I don't see it as a con so much anymore. But you might be a person who, if they saw that, they're like, I don't want any part of that. So going further, your patient can start to crash at any moment, because a lot of them are so critical that they could be on the verge of dying, and that might put a lot of stress on you as the nurse, or it does. Basically have to be very diligent with your assessments. So if that's something that you do not like, then you wouldn't want to work in an ICU. So yeah, a lot of these things they might be considered cons to some people, or some people might say, hey, that's pro. I like all that intensive, crazy stuff where shit might happen at any moment. So that's that. You might have patients crashing. And going even further, in an ICU, you're going to probably experience at some point in time patients passing away. So if you don't want to be around that at all, you would probably think, that ICU is not the place for you. So if you ever hear rapid responses being called in the hospital, they might be stabilized out on the floor, or, if they can't stabilize them there, that means that they are coming to an ICU. So whatever's happening out there, if you work in an ICU, you know that hot mess is about to come to you. But once you become a little more comfortable working in an ICU, none of this really is a con, it's just a part of working in an ICU. So kind of summing everything up, the pros of night shift: the money, not as busy as day shift, not having to serve meals, not as many visitors, not as many new orders coming in. The cons, your body just hates you. Alright, and then working in an ICU, the pros: you have 2 patients. You get to focus all your attention on those 2 patients, as well as helping anywhere else on the unit where stuff's going crazy. And your skills stay on point. You get to do all sorts of interventions and try all sorts of stuff and see all sorts of stuff. So you kind of become super nurse, being able to handle anything. You're going to get to experience codes, which some people might not see it as a pro. And you get to have your patients on continuous monitoring, which I like. So the cons of an ICU: there's patients that are very critical. They can be very stressing because there are all sorts of things going on with them. Something as simple as the patient wanting to poop. If they have tubes and drains going in and out of them, and they might have a feeding tube, and they might have all these drips, and they might have a breathing tube in them as well, and their legs might not work. Something as simple as that becomes pretty difficult. So that can be seen as a con, that there's just a lot going on with your patients, and it can be pretty stressing. So you're gonna have the codes, you're gonna have patients that pass away at times, and you're gonna get the rapids, and the ICUs, it can be super critical all the time. Your whole shift, you could have these super critically ill patients that are requiring a lot of interventions, and you might see those all as cons, but eventually, after working in an ICU for a while, might not be so much cons, and you might actually like it and consider that a pro. So that sums up my video: pros and cons working night shift and working in an ICU. If you have comments, you know some pros and cons of working night shift or working in an ICU or working on the floor, feel free to put them in the comments on this YouTube page. And yeah, that sums up video 3, being a new nurse. Feel free to check out, go over here, video 1 and video 2 of being a new nurse. Also, you should subscribe. I'm gonna put a button here. I'm juggling a lot, y'all. And you should subscribe to my channel, because if you're like in nursing and you want to watch some nursing videos, or you're in nursing school, or you're thinking about being a nurse, or you just want to watch some videos, I post videos about being a nurse. I have videos from when I was in nursing school. I also post videos of random adventures that I go on, and sometimes I review stuff too, because I'm kind of like a tech nerd. So yeah, you should subscribe and watch the videos. It like flips when I'm recording, so I need to point that way for the videos. This way. Shit, to subscribe. Okay.